Hello, let's discuss this question. A 42-year-old woman comes to the office for evaluation of a mass at her wrist. The patient first noticed swelling in her wrist a few months ago after spending a week knitting blankets for her family. The mass has not caused any pain or stopped her from participating in daily activities, but it continues to slowly increase in size. Medical conditions include hyperlipidemia and rheumatoid arthritis. Medication includes methotrexate, statin, and occasional ibuprofen. Vital signs are normal. BMI is 28 kg per meter square. There is slight ulnar deviation at both wrists with a 2 centimeter mass on the extensor surface of the right wrist and no overlying skin discoloration. The mass is firm, mobile, and non-tender to palpation, and it trans-illuminates on pen light examination. Which of the four is the most likely diagnosis in this patient? So the patient, 42-year-old woman, presented with the mass on her wrist, which is on the right wrist on the extensor surface or dorsal surface. Then the mass is firm, mobile, and non-tender to palpation. Okay, and it trans illuminates on pen light examination. The patient has past medical history for significant for hyperlipidemia and rheumatoid arthritis, and medication she was using regularly was methotrexate, statin, and occasional ibuprofen. So the most likely diagnosis in this case is ganglionic cyst. Why the ganglionic cyst? Because the mass is firm, mobile, non-tender to palpation, and it transilluminates. So let's discuss the explanation for this question. Okay, so the patient, this patient with a mobile, non-tender swelling at the dorsal surface of the wrist has a ganglion cyst. Ganglion cysts are generally harmless lesions that are most common in patients with underlying joint disorders or prior joint injury. They can occur in both upper and lower extremities but are most common at the wrist. Ganglion cysts are typically filled with mucinous fluid and often communicates with the underlying joint through a hollow pedicle. Fluid is postulated to flow from the joint space to the cyst, and one-way valve mechanism prevents return flow to the joint. The diagnosis of ganglionic ganglion cyst is usually obvious on inspection and can be confirmed on transillumination of the mass. If in doubt, ultrasound or MRI can confirm the diagnosis. Okay, but imaging is rarely necessary. Most ganglion cysts resolve spontaneously and require no treatment. For the few patients with painful and persistent symptoms, options include aspiration and surgical excision. Then the other options like epidermoid cyst, lipomas, and rheumatoid nodules are not right. Why? So the epidermoid cysts are small, freely mobile nodules, typically with a central punctum. Okay, they develop most commonly on the palmar surfaces of the digits, while the lipomas are soft, fleshy masses found in subcutaneous tissues. They are usually on the trunks or shoulders, while the rheumatoid nodules are firm, fibrotic masses typically found in subcutaneous tissues overlying pressure points, for example, olecranon, dorsal forearm. Unlike ganglionic cysts, these lesions do not transilluminate. So the main differentiating point is transillumination. While the choice E, which is tendinous xanthomas, these are smooth, firm growths that are most commonly seen in patients with severe hyperlipidemia or lipid storage disorders. They are typically multifocal, most common on the Achilles tendon, move with the tendon and do not transilluminate. So the ganglionic cysts are mobile, non-tender swelling that occurs most commonly at the dorsal surface of the wrist. The diagnosis is usually obvious on inspection and can be confirmed on transillumination of the mass. Most ganglion cysts are resolved spontaneously and requires no treatment, but when the ganglion cyst persists and it is painful, then we can do the surgical options like aspiration of the ganglion cyst and surgical excision.